Okay, this is your lecture for the mood disorder chapters, so bipolar and depressive disorders. You can see here that I have created a chart. Mood disorders are what we call episodic disorders. What that means is that we diagnose them based upon the episode that the individual is having. So if we're going to separate the 5 main disorders in this chapter, then what we're going to do is we're going to do it based upon the appearance of particular types of episodes. So let's talk about these episodes first. The first category I have here is depressive episodes. So depressive episodes, you can see the criteria in the book, but essentially they have to last for at least 2 weeks. That's really important because people are sad every now and then, but you have to be sad every day for nearly most of the day for a full 2-week period, and then you have to meet the other criteria. So I think there's like 5 different criteria out of 9 that you have to have, one of which either has to be sadness or loss of pleasure. So it's really important to pay attention to what a depressive episode is. The second type of episode that we have here is called a manic episode. It's the opposite of depression. It's where an individual is feeling really, really elevated in terms of their mood. However, there also comes some negative consequences. Things like risky behavior, things like a flight of ideas where they just have so many ideas that they can't communicate very well. They don't sleep. They tend to be really impulsive. These kinds of symptoms. Manic episodes only have to last a week. So whereas depression is 2 weeks, manic only has to be a week. Or if the symptoms send somebody to the hospital, which often happens, then it's considered a manic episode even if it hasn't been a week. Hypomanic episodes are milder versions of the manic episode. So you feel elevated, but you're getting a little bit of sleep each night. Maybe you're doing some risk-taking stuff, but not like intense stuff. So a risk activity for a manic episode might be sleeping around with a bunch of people. A hypomanic episode, they might be flirting with people, but not necessarily sleeping with them. Then I have 2 other categories: depressive symptoms. So you don't meet the full criteria for an episode, but you have symptoms. And hypomanic symptoms, same thing, not the full criteria, but you have symptoms. All right, let's start with MDD, or major depressive disorder. This is what we think of when we think about depression. And essentially, to get that criteria, all you need is the depressive episode. So MDD can be, there's 2 different types. One is single, where you just have the depressive episode one time in your life, and it lasts for 2 weeks or more, but it's only one episode, and you never get it again. Only about a third of people are like that. 2/3 of people with MDD are what we call recurrent type, so that means they get episodes throughout their life. All right, the second type of depressive episode we're going to talk about is dysthymia. It's also called persistent depressive disorder, and that you really just need depressive symptoms, but it has to be long-term. That's what that little star means. So it has to last for at least 2 years. So almost every day, doesn't have to be exactly every day, but almost every day for 2 years, you have these mild depressive symptoms. That would be dysthymia. Okay, now we get into bipolar 1. With bipolar 1, all you actually need is manic episodes. So you must meet the criteria for a manic episode, and bam, you're at bipolar 1. Now, most people also meet criteria for depressive episodes in bipolar, but it's not required for diagnosis. Manic episodes is the only thing required for diagnosis. With bipolar 2, you must have depressive episodes, and you must also have hypomanic episodes. So bipolar 2 is kind of a milder version of bipolar 1. If you ever meet the criteria for a manic episode, you automatically bump up to bipolar 1. Now, cyclothymia is kind of like dysthymia. You'll notice the similarities, but you don't meet you don't meet the criteria for episodes. You simply have symptoms. You have hypomanic symptoms, and you have depressive symptoms many times for the period, again, of 2 years. So this is the long-term sort of mild version of bipolar. And so it's these episodes that we use in order to distinguish between, do you have major depressive disorder, do you have bipolar disorder, are you bipolar 1, are you bipolar 2? This is what we use in order to separate somebody. Now maybe you might have guessed based upon how I've been talking about these, is there's a lot of overlap between them, and a lot of things that oftentimes when people come to us with these disorders, we don't necessarily know, like how long certain things have lasted, have they been lasting throughout your whole life, is this something that's because of just a situation in your life, or is this something that's more long-term? So diagnosis can be really difficult when we're trying to separate these components out. All right, that is what I want you to kind of focus on, but there's lots of other stuff in this chapter, so make sure you check out everything else. But that's how we separate mood disorders.